So now we will be talking about the effects of general anesthesia. General anesthesia has effects on the central nervous system. So general anesthesia generally decreases the metabolic rate in the brain, or the cerebral metabolic rate, or CMR. So if the metabolic rate of the brain decreases, blood flow to the brain also decreases. We also have stages of CNS depression. So because we understand that general anesthesia generally causes depression of the central nervous system, there are actually stages of anesthesia, or stages of the increasing depth of CNS depression. So these are what you call the Giddel signs. So stage 1 is the stage of analgesia. So initially, there is analgesia without amnesia, but later on, amnesia develops in stage 1. In stage 2, this is also known as the stage of excitement. But this is a different kind of excitement. The patient appears delirious and may vocalize, but the patient is completely amnesic and will not remember anything. So it's just like someone who is drunk. Okay, so also in stage 2, you will notice that there will be a decrease in the vital signs of the patient. So the RR will decrease, the heart rate will decrease, and the blood pressure will also decrease. So the duration and severity of stage 2 is shortened by rapidly increasing the concentration of the agent. So if you increase the concentration of the anesthetic agent, you will go to stage 3, which is the stage of surgical anesthesia. So this is actually the goal of anesthesiologists, stage 3. So this begins with slowing of the RR and the heart rate. Sometimes it also extends to apnea. It may extend to apnea. And then you will also notice changes in ocular movements, in changes in the eye reflexes, and changes in the pupil size. But you only want the patient to be up to stage 3. You do not want the patient to reach stage 4, which is the stage of medullary depression. Okay, you don't want the patient to reach the stage of medullary depression, because in this stage there is severe depression of the vasomotor center in the medulla and the respiratory center in the brainstem. So the patient's circulatory and respiratory systems fail. So without circulatory and respiratory support, the patient is going to die. So you do not want to reach this stage of anesthesia. So general anesthesia also has nausea and vomiting effects on the nervous system. This is because of the action of anesthetics on the chemoreceptor trigger zone and the brainstem vomiting center. General anesthesia also has hemodynamic effects. So generally, it decreases the systemic arterial blood pressure. This is actually the most prominent effect. This may be due to vasodilation. This may be due to myocardial depression. This may be due to blunting of baroreceptor control. And this may also be due to generalized decrease in sympathetic tone. General anesthesia also has respiratory effects. One of the most important is its reduction or elimination of the ventilatory drive and reduction in the reflexes that maintain airway patency. So, in times of extreme stress, you do not want a patient who stops breathing. If you remember, in times of emergency, when we resuscitate a patient, remember, A stands for airway. So, the gag reflex is lost, the cough reflex is also affected, and the lower esophageal sphincter tone is also lost. What happens if there is a loss of tone in the lower esophageal sphincter? This increases the risk for regurgitation and aspiration. Actually, all of this will lead to aspiration. That's why it's dangerous. Now, general anesthesia also has effects on the body temperature, specifically hypothermia. This can be due to the low ambient temperature. This may also be because of the exposure of the body cavities. Of course, you're opening up a patient. also because of the altered thermoregulatory control affected by the anesthetic agents, and because of reduced metabolic rate. So if there is reduced metabolic rate, there is also reduced generation of heat in the body. So specifically, there is a 30% reduction in the total body oxygen consumption. So also very important is knowing the effects of general anesthesia causing emergent and post-operative complications. So there is what we call the emergence excitement. So the regain of central nervous system sympathetic tone, the return of pain sensation, tachycardia, restlessness, crying, moaning, thrashing. Also, the patient may experience delirium or confusion, spasticity, hyperreflexia, and Babinski signs. All of these are events that may happen when the patient comes back from the anesthetic state. Also, the patient may have shivering from the hypothermia. The patient is going to try to physiologically increase or generate heat. Also, because of the loss of the reflexes that maintain the airway or airway patency prior, there may be airway obstruction. And there may be reduced pulmonary function, causing hypoxemia, which can also be compounded with the respiratory suppression from opioids that are given to control the pain after surgery. Now let's talk about the anesthetic state in a patient who has general anesthesia. The anesthetic state is actually a drug-induced state of coma, and there are five components to the anesthetic state. Number one is immobility. Number two is unconsciousness. Number three, amnesia. Number four, analgesia, and we also have the attenuation of autonomic responses. Now, immobility is brought about by relaxation of skeletal muscle. So it's actually the easiest anesthetic endpoint to measure. And this is also the endpoint that we measure, that is referred to when we measure the MAC, which we will talk about in a while. So this may be due to inhibition on spinal cord networks, and this is also likely through suppression of central pattern generators important for coordinated movement. And this may also include inhibited nociceptive transmission to the brain. So, in other words, the patient in an anesthetic state is not able to move. Remember, we're talking about general anesthesia. The second is unconsciousness. So, the unconsciousness is likely due to enhanced inhibition at multiple sites in the cerebral cortex, in the thalamus, and in the brainstem. Okay, according to Katsung, the reticular activating system. So, again, in other words, a patient under general anesthesia is unconscious. Third, we have amnesia, which is actually, if you remember, the first stage in the anesthetic state. So amnesia is due to altered neurotransmission in the prefrontal and frontal cortices, in the hippocampus and the amygdala, and also in regions of the sensory and motor cortices. Amnesia is reliably prevented at low MAC or MAC values. So MAC is the measure of the potency of anesthetic drugs. Okay? Now, immobility, unconsciousness, and amnesia, this is what is referred to as the essential triad. Number four, we have analgesia. So analgesia is likely due to disruption of spinothalamic tract transmission and peripheral nociception. And then we have attenuation of autonomic responses. However, this is poorly controlled in inhaled anesthetics. That's why, aside from giving inhaled anesthetics, anesthesiologists also give opioids or supplement with the use of opioids to decrease the autonomic responses of a patient. So we talked about the MAC earlier. MAC stands for minimum alveolar concentration. So the MAC is actually a measure of the potency of anesthetic drugs. This is measured by determining the concentration of general anesthetic that prevents movement in response to surgical stimulation, or in our case, surgical incision. So at what level or at what level of concentration will the patient not move when you do a surgical incision? So that is how we measure the potency of an anesthetic drug. So inhalation agents are measured according to Mach units. So when we say 1 Mach is equal to the minimum alveolar concentration that prevents movement in response to surgical stimulation in 50% of subjects. Okay, now we go to the mechanism of action of general anesthetics. So, anesthetics affect neurons at various cellular locations, but the primary focus has been on the synapse. So, anesthetics can affect neurons by actions on the presynaptic neuron, or it can have postsynaptic effects, or it can have an accumulation of both. So, for presynaptic action, anesthetics may alter the release of the neurotransmitters. So the anesthetics can also have a postsynaptic effect by changing the frequency or amplitude of impulses exiting the synapse. And also, anesthetics can affect neurons by a cumulative effect. The inhibition of neurotransmission can be strengthened or the excitation is diminished. But anesthetics usually most of them affect the synapse or and affect neurotransmission by strengthened inhibition of neurotransmission. So the principal molecular targets of anesthetic action are the neuronal ion channels that mediate impulse conduction. So we have different ion channels. It can be inhibitory or it can also be excitatory. So both inhibitory and excitatory ion channels can be affected by anesthetic agents. So for inhibitory ion channels that are affected by anesthetics, we have the chloride channels. Example, the GABA A chloride channels, which are sensitive to a wide variety of anesthetics, including halogenated inhaled agents, intravenous agents, and neurosteroids. So, the increased sensitivity of GABA A to GABA or GABA aminobutyric acid causes enhanced inhibitory neurotransmission and depressed nervous system activity. Okay, again, so if the GABA A channels are more sensitive to GABA, remember these are inhibitory channels. So there is enhanced inhibitory neurotransmission. This leads to depressed nervous system activity. And we also have glycine receptors. So inhaled agents enhance capacity of glycine to activate glycine receptors. So this is important in inhibitory neurotransmission in the brainstem and spinal cord. So examples, propofol, barbiturates, and neurosteroids potentiate glycine-activated currents. And we also have potassium channels. So an example of these are the two-pore domain channels. So these two-pore domain channels are activated by halogenated inhalational anesthetic agents. So for excitatory ion channels that are affected by general anesthetic agents, so of course, because these are excitatory ion channels, agents will affect excitatory ion channels by inhibition of these excitatory ion channels. So channels that are activated by acetylcholine can be affected by general anesthesia. Also those that are activated by glutamate, of which the NMDA receptors are under. So these are inhibited by ketamine, nitrous oxide, cyclopropane, and xenon. And also ion channels that are activated by serotonin, specifically the 5-HT2 and 5-HT3 receptors.